Welcome back, guys. We are finally on the last part of the series for the revenue cycle in the physician's office. This is part 4. So we are finally to the end. We have 3 more sections, which I'm going to cover in this video today. I wanted to thank you for following me through. If you've watched from 1 to part 4, that means you're interested in the revenue cycle. And I hope that you have, gotten a better understanding of what the revenue cycle is and how it works and how your position may be in the revenue cycle, or if you wanted to get in it and be a part of it, how you can fit into the revenue cycle. Also, I would like to always do my disclaimer, which I do every video for the revenue cycle, is that different people have different types of revenue cycles. I don't know if I want to say types, but they have different sections. So I have 10 sections in my revenue cycle, but there are others who may have 5, may have 6. If you can hear my puppy in the background, please excuse him because he gets a little rowdy sometimes. He must be seeing something out there. But like I was saying, there are different sections that they may put it in. For mine, which I'll put up on the screen, there are 10 sections. So right now we're on the last 3 sections. And it's basically the same duties, but sometimes people put them in different ways. Okay, so let me stop rambling about that. I'd also like you to subscribe. If you have gone through all the parts of the revenue cycle with me, that means you are interested in the information that I'm giving you, and that's the information that I will be giving you for 2022. I'll be talking about the revenue cycle, of course, medical billing, and a little bit of practice management in that. So if you are interested in that, please subscribe to the channel. You can just click the little button, like this video if you like it, and share it and comment below. And I answer back. I try and answer back as quickly as I can any questions or comments that you may have. So let's jump in to the last part of the revenue cycle in the physician's office. If I haven't introduced myself yet, my name is Tamika. Hi, how you doing? I am a certified professional biller and a certified professional practice manager and an AAPC approved instructor. So now that we've gotten that out of the way, let's jump into patient billing, which is the next part that we're going on. So for patient billing, if you do things right, you most likely will not have a patient statement. Now, that sounds good, like if you do things right, but for the most part, you're always going to have patient statements to send out. You try your best at the beginning when you check patients in to find out what their responsibility is, how much they will owe. Even when they come back out after seeing the provider, you try to estimate what they might owe if any other extra procedures or, anything else was done, injections, stuff like that was done. But for some reason, we always, for the most part, will have statements. It might not be a lot of statements, but there are statements that we will probably have to send out to the patients. It is important for you to send out statements to patients consistently and make sure that your patient statements are concise and clear. At least I think it is, because I realize in different offices that I work for, if the patient statement is not clear, the patient is not going to pay. Now, I'm not saying that if your statements are clear and you send them out consistently that you're always going to get paid, because they're just people who might not pay. But for the most part, a patient doesn't pay because they don't understand. Whether it's that they don't understand what this statement is saying, whether they're trying to figure out why they even owe anything because they figure the insurance is supposed to pay. So sending out statements is important, and sending them out consistently is important so that the patient can be reminded that they owe this amount. If I come into your office on January 1st and I don't receive a bill for that service until January 1st of the following year, you probably won't get your payment. And that sounds bad, but it's the truth. Because some patients go to many doctors. Some patients go to one doctor and might not even remember going to that doctor. I've had several people call me sometimes and say, well, I've never been to this provider before. And then I would have to remind them, well, on this date, and you had this done, and then they'll say, oh yeah, I did do that, or I did go there, or whatever the situation is. So some patients don't remember that they even went to the provider. So you want to make sure, if I come in on January 1st, you bill out my service, you might get paid, 2 to 3 weeks after that, and then there's a balance, that you then send the patient a statement at that point in time. Now, depending on your practice, you may send outpatient statements monthly. You may send them out every other month. It just depends on your process in your practice. Now, there are some best practices or some standards that you should probably follow, but I don't, everybody's practice is different, and you need to decide what is right and important for your practice. There are now many ways that you can send these statements out. You can send them out by just manually going through the patient's charts and sending them by paper. You can send them, your clearinghouse can send the patient statements for you sometimes. I've never had that done, but I've heard that it can sometimes be costly if you do it that way. There are different ways that you can send. You can have the patient be able to pay you online, which, with all the technology now, some people prefer to do it that way. So there are different ways for you to collect your payments, but you just need to make sure you send them out consistently and that they're clear, that the patient understands why they owe this. Now, just because, like I said, the patient statement is clear, that doesn't mean you won't get questions. So prepare yourself for getting questions from those individuals who will call you. There are some patients who call and say, I just received a statement and I don't know why. Or I just received a statement and I'm not sure why it's that much. My copay is $30 and I paid that $30 when I was there, but now it's saying I owe another $30. There can be many different types of scenarios, but just make sure, if you're the person who they would speak to, whether it is the biller, because in most of the offices that I work for, the biller would be the person who would answer the questions if the front desk did not know the answer to it. Normally the front desk is the people who answer the phone, and if a patient asks a question, then they would, try their best to answer it. But if they don't understand or don't know why, then they would pass it along to the biller. So just be prepared to answer these questions for your patients as the biller, and don't feel any way about educating patients. Now, I like to educate patients, and I feel that when you do, you get a better outcome in your payments. I've gotten times when I've explained a patient's deductibles or how their copay works or their out-of-pocket works, and it has helped them pay their bill because now they understand. It's not just about taking the money from the patients and just saying, well, it's their insurance and they should know about it. Educate your patients, because I think you would have a better outcome when it comes to getting paid. Now, I have a video about patient statements, so I'll link it up in the cards just to give you an idea about those and what should be on the statement if you're the person who's designing it, or you're the biller and you realize that your statements are not clear. These are some of the things that should be on the statement so that the patients should or would want to pay or understand why they are paying. The next section is accounts receivable follow-up. So again, even through all the things that we have passed through, collecting payments and sending out patient statements and all of those things, where we are trying to collect payments so that we don't have a big accounts receivable, we most likely will still have accounts receivable reports. Now, this can be for different reasons. It can be because depending on when you print the accounts receivable report, you may still just be waiting for the payment from the insurance company. Now, there are two account receivable reports. There can be patient account receivables and insurance account receivables, which are normally on two different reports. So if it's an insurance report that you're printing out, it can be that you are waiting for payment from the insurance company. You just mailed it, you just sent out your claim maybe a month ago, and maybe there's some type of tie-up at the insurance company. So then that's why it's on the AR report. Also, it can be that a claim wasn't even sent out. A person came in for a data service, but somehow it slipped you billing it out. And this depends on your processes and systems for sending out claims and matching up to make sure that the appointments and the claims that are sent out, are all done so that you won't miss anything. But sometimes you miss those things. It can also be because of your specialty. Now, in working in OBGYN, we do global packages. And with that, a patient may come in several times before we actually bill. And that's because if we're doing a global package, we don't bill until after the patient has delivered. So a patient's account will be on my AR for a while because they're pregnant for 9 months, 8 months. So it will be on my AR for a while. Now, for somebody like me, when I'm looking at my AR report, these things I won't necessarily take into accommodation. I will definitely look through them and make sure that the patient hasn't transferred, that the patient is still coming in, that the patient has been paying down on their responsibility or their portion of it. But it's not really a concern when I'm looking at it because I know this is because I have not billed it out because the patient hasn't delivered yet. When you're doing AR, you want to look at the most important ones, meaning the insurance companies that are the highest and also have the shortest time for timely filing. Now, I think I need to do a video about timely filing, but I've spoken about it in some of my other videos that you have a specific amount of time that you can send a claim. So if I have $50,000 in outstanding agent receivables or accounts receivables for, let's say, United Healthcare, $50,000 outstanding, and their timely filing limit is 90 days, then I need to work, even though I might have another one, let's say Medicare, that has $100,000 of outstanding receivables. I will work, but Medicare's timely filing is 365. So United Healthcare's is 90 days. So I need to deal with that first before I deal with the Medicare one. Again, like I said, you need to make sure that it's consistent when you do these reports, whether it is every 2 weeks, every month, every other month. And again, it depends on the size of your practice, on how many patients that you have, because if you're having one person do the accounts receivables and you have a huge practice, maybe they might not be able to get to all the patients every month. So then they would have to split it up and maybe do half 1 month, half a next month, and then so it's every other month that the agent is being done. So it just depends on your practice and what is right for you. When you're working on your AR, as I was mentioning, I think I kind of went into it a little bit about prioritizing which ones you're going to do first. They are usually, I'll try and show a picture of what an AR report looks like, because they're usually in buckets that show you, well, this is 0 to 30, and this is, 30 to 90, and this is 90 to 120, and this, or something to that effect. So it'll show you the buckets that your payments in. So your total amount of AR might be $100,000, but in bucket 0 to 30, you have 70,000 of that. And so if that's the case, then that's not necessarily bad, because those ones that's from 0 to 30 is more recent. Maybe you just sent them out and payers don't pay until 2 weeks or 3 weeks, or so you still have some that's outstanding. So that bucket is not too bad. It's the ones that keep going further out and further out and further out that is bad, and that you need to look at and prioritize. And our last section is collections and refunds. And for me, anyway, this section is one that most billers, most practices, most people forget. Because first of all, number one, after you send out your patient statements and you have a policy in place where you say, we're only going to send out 3 statements and then we send them to collections, or, whatever the situation, we're going to send 3 statements in a row, we send them to collections, something to that effect. there are a lot of practices that don't have that policy in place. And some of them feel like they don't want to send their patients to collections because they don't want to have any bad malice with their patients. They want them to come back. And that, again, is all up to you. But remember, if you don't send them to collections, then you may not get a chunk of money. Also, with collections, you have to remember that you will have to pay the collection agency. So I've dealt with collection agencies that charge up to 40% of what is owed. So if I send in someone who owe $100 and they actually paid $100, then the provider only gets $60 because they're taking $40 from that. With collections as well, you should have a limit. So you'll have a limit to where you would send it to collections. And some people's limit is $50. Anything under $50, they put it as bad debt. And if the patient comes in after that, the patient can just pay them straight out. But if it's anything over $50, then they would send it to collections. But again, that's up to you and your practice. Then when it comes to the refunds now, who wants to give away money? Nobody wants to give away money. So sometimes, and this is for insurances or patients. So sometimes that area of the refunds gets forgotten about. Now, with insurance companies, sometimes they request the refunds and sometimes you have to just give them back the money if you know they've overpaid. You don't want to hold on to money that is not yours. If you have a data service and they were supposed to pay $90 and they paid the $90 and then 2 months later they paid another $90, you should refund the insurance company their payments. Now, a lot of doctors, I'm just going to keep it real, a lot of doctors don't. They wait until the insurance company requests it and then they pay them back. Again, you should actually send the insurances their refunds. And I think sometimes in the contracts, it states how refunds are dealt with and what you should do. So again, you should be refunding back their money. Also with the patients now, there's some patients who actually read their explanation of benefits, their EOBs. And so they would call you and say, well, I paid $50, but my insurance paid for my whole visit and I want my refund. So you need to give them back their refund. There are a lot of patients though who don't read their EOBs and so they don't even know they have a refund. Again, if you see that a patient has a refund, you need to refund them back their money. Now, you also need to put that in a system as far as saying, well, we're going to refund this certain amount of money. So you might make a list for each month. You pay out a certain amount of money because of course you don't want to have to pay out so much money every month and just deplete all of the income that you got in. But you want to make it a consistent routine process where you can be able to, let's say every month we're going to pay out no more than $10,000. And if a patient requests their refund, then we'll make sure that we put that patient on the list, one of the newer, earlier lists, so that they can get their money. Something like that. But collections and refunds are important and you need to do them. So don't forget about them because they are an important part of the revenue cycle. It will give you a clearer picture of, how much your profit and losses and what you're making and your revenue cycle in general. Because if you have a whole lot of refunds that you're owing, but it shows that you have that income in, it may show that an inflated amount of income that you have in when a lot of it might not be yours. It might say that you have $1 million in revenue, but out of that $1 million, 40,000 or 400,000 is refunds. So you just want your numbers and your reports to be correct. So you want to make sure that you collect in your money, of course, but also send out refunds when you need to. And so that is the end of our series. That is the fourth part. If you're just catching us and you don't know what the other parts are, I'm going to link it. So please watch the first and through the third part. We have 4 parts in this series. And if you have any questions in any of them, I might have missed some things. I didn't want to make these videos too long. I just wanted to give you an idea of how it worked. So if you have any questions, please leave them in the comment below of any of the videos that you have the question on. And Remember to subscribe to the channel, because we'll be doing more things like this. If there's anything else that you want to know, I always say, put it in the comments and I will try my best to make a video for them. I will see you again next week for another medical billing video.